Bismillahirrahmanirrahim. This is your guest. Take 2 minutes, Dr. Mazum, and then we will do it,
Sure, ma'am.
inshallah, within a take 2 minutes.
Sure, ma'am. Ma'am, is the case shared with me, like on the screen?
It's not shared. No?
Yes, yes,
Yeah,
ma'am.
yeah. Sorry. I think somebody's video was on. That's right. Just. I think it's visible, right?
Yes, it's visible now, ma'am.
Okay. So your time starts now, inshallah. Just take 2 minutes and then we will start. And Dr. Hiba, are you there? The next quiz will be for you.
Yes, I am there.
Okay. Thank you. So the next quiz will be for you. Shall we start? Dr. Mazum, are you ready?
Yes, ma'am. Ready.
Okay. So just
Hello.
yes, just a minute. I will put the timer for you. So I will give you 8 minutes. Your time starts now.
Sure, ma'am. Hello.
Hello.
This is Dr. Ahmad, one of the doctor in medicine clinic. Am I talking to Mrs. Shannon, 45 years old?
Yes, doctor. Actually, it should be Mr. Sorry, it should be Mr.
Okay.
Sharon Dash.
Sorry.
Hmm.
Am I talking to Mr. Shannon, 45 years old?
Yes, doctor.
Mr. Shannon, nice to have you. I hope I haven't been keeping you wait too long.
Yeah, doctor, it's okay.
Mrs. Shannon, we are here today to discuss something about your health.
Okay.
Are you
Yes,
aware of
doctor.
it?
Yes, doctor, I am aware of it.
And what do you expect from that, our meeting today?
Actually, what happened, doctor? I'm having hypertension, this high blood pressure for last few years. It's almost like 4 years now. And yeah, I'm following up with my doctor very regularly. I'm very conscious about that one. And I'm taking medication also regularly. So what happened actually, last time, this yesterday when I came here, they did some follow-up test with me, and I don't know if these are normal. They told me to talk with you. What happened, doctor? Is there something serious?
Mr. Shannon, first of all, I really appreciate you discussing it with us, taking it up on you and coming back to us. Number one. And number two, I will say that I see that you have been managing your blood pressure very well with amlodipine,
Yeah.
the medicine that you have been taking. It's very much appreciate this thing that you have been taking it regularly. Mr. Shannon, recently during the follow-up, some of the blood tests done revealed that you have high levels of cholesterol in your blood. which means fats. It's one of the constituent of the food that we take, and it breaks down into fats. And medically, a technical term for it is cholesterol. Are you aware of it?
Yes, I know about this cholesterol, doctor. Oh my
Mhm.
God, how come it happened, doctor? Not, I don't know. I'm not taking that much fat. So why it is high?
Your concerns are well placed, Mr. Shannon. I can understand your worries and anxiety regarding it. There are many reasons for it. We cannot just place it on the food that you are taking it. It can be because of your genetics. It can be because of a disrupted mechanism inside your body, because of the
Okay.
workload, because of the stress. Multiple reasons to it. Are you aware of it? What I'm saying, Mr. Shannon?
Okay. So you are telling it is not related to diet exactly. It can
It is
have.
related to a diet as well, but there are multiple factors other than diet. You mentioned that you are very strict about your diet. I
Uh,
appreciate that. But
yes,
there are
yes.
multiple factors like exercise, genetics. I mean,
Okay.
something about the genes, like we pass something on to us from our parents. So, multiple factors.
I get it now, doctor.
Mhm.
So, doctor, what should I do now?
Now, as per the protocols laid down by the guidelines, and we have to put you on something called statin. I know it's a technical term, it's a medical term, but it's a drug category where we give you something that lowers the level of cholesterol. Are you getting my point?
Yeah, yeah, I get it. Okay.
Mhm. Does it bothers you if I tell you something about medication further?
No, no, doctor, I want to know.
Mhm. So, Mr. Shannon, it's a whole class of medicine. I know you must be knowing that medicine has got its own category, drugs have got its own category. So, one of the prominent category that we use for lowering the cholesterol is statins. It has got different set of drugs. And why we feel the need to lower the cholesterol is that cholesterol is bad for your heart and for your body overall. Do you understand my point?
Okay.
Do you
So
want
it's
me to tell you?
dangerous.
Yes, it's dangerous. It can be
Okay.
dangerous.
Okay.
Do you want
So
me to
I
tell?
should, yeah, so if I'm taking it, is there anything as any side effects? Because some medication, I'm afraid, doctor. Already I'm taking one medication, amlodipine.
Hmm.
So should
And
I take another medication? I'm afraid to take so many medication at a time, doctor.
mhm. Your concerns are well placed, Mr. Shannon. Have you heard something about statin that you want me to add up to from the your surroundings or the media? I want to know your perspective. Have you heard something bad about it?
No, doctor. I actually this is a new drug you just mentioned to me.
Yeah, actually, the benefits of taking statin is high if we compare it with the risks, which are negligible. Number one, Mr. Statin. Why I'm talking about the benefits? Because cholesterol is a substance, it's a fatty substance. So when it's high in your blood, the blood channels that leads to your heart and comes back from the heart supplying to whole of your body gets a deposition of it. And
Okay.
over the period of time, when you have high blood pressure, your arteries are under stress, and with these deposition, they lead to blockage. Are you getting my point?
Yeah,
I will
yeah, I'm
I
trying
will
to
draw
get
it.
it.
I will draw it for you. This is, for example, this is a channel,
Mhm,
and because of your blood pressure, it's
mhm,
already under stress. I know it's
mhm,
controlled, but sometimes there are erratic controls.
mhm.
And imagine this is a deposition, a tiny extra lining inside, providing a blockage.
Okay.
So over a time, if you don't control it, there's a buildup, and it
Mhm.
can lead to fatal consequences.
Okay. Okay. But doctor, if I do, is there anything else? Like if I'm doing very much controlling of my diet, I'm doing a lot of exercise. I want to avoid actually extra medication. Is it possible?
Uh, do you have any reason for it? I mean, any other
No.
reason than
No,
just
just because
avoiding
I don't
medication?
want to take multi-drug, more than one drug. I don't like to take many much drug medication.
I understand your concerns. It's well placed, Mr. Shannon. We all, nobody likes taking up medications. But if you look at the benefit it provides in saving your heart from
1 minute
getting
remaining.
yeah,
Yes, continue.
if you look at the benefit it provides you in saving your heart, in your blood channels, in saving your brain, in saving your lungs, in saving your kidneys, you will obviously be inclined to get it
Okay.
and
So
take
is
it
there
as a
any side effect?
the side effects are minimal. So we will keep an eye on it. We will do 3 monthly blood tests for it to checking the liver enzymes. We will also keep an eye on some blood tests, making sure that it's not causing damage to your muscles as well. These are the only known side effects and very rare as well. So
So it can affect my muscle and my liver.
very rarely, but we will keep an eye on it.
Okay.
In terms of doing some blood tests like CK, and we'll be doing baseline tests like LFTs. I know it's a technical term for you. In liver function test, we check some enzymes of the liver. If they are high,
Doctor, I will take it. I will take it.
Thank you so much. Any other thing that you want me to address for you?
No, time finish.
We will. Okay, thank you.
Thank you. Thank you. Thank you for your time.
Thank you, ma'am.
Yes, well done. Awesome. Obviously you did good, but little tuning, just fine tuning. Okay. Let's start from the beginning. Okay, somebody was telling me I cannot see the case. Once you entered the room, they will take from you the question paper. So obviously that 2 minutes is the only time you are going to see that paper, that scenario. So the first duty is we should write down everyone that what it is written, an important topic. So that's why I omitted it purposefully from the screen. Okay. So whenever you are going through the communication, just write down whatever you needed, the specific, like the name. I'm sorry, the name should be Mr. Sharon. It's a typing mistake. So it should be Mr. Sharon. So you have to write your name, your duty, everything. So let's talk about first about the performance, and then we will go for the discussion. Okay?
Sure, ma'am.
So, okay. So first of all, your introduction was very good. And let me tell you, mashallah, your English, the making up of sentences and the confidence and the fluency is very much good. And that's what they're searching for, actually. This is a very good impression whenever you are talking and you are not using the exact, memorized lines, rather than you are making up your own lines, try to make the patient understand. This is a very plus point for them. This is giving a very good impression to the examiner. Okay, so obviously this is I should praise about that one. So you introduce yourself. You told, actually here you see you are SHO, that means senior house officer. You just told doctor. Just better, whatever you are, even if you are registered or senior house officer or medical officer, you need to mention that exactly. That's
Sure.
what your introduction. So you just told, I think somehow it was missed. It was doctor you told. Okay, introduction was very good. You asked me about expectation. In between, it is plus minus. You could ask about, do you want anyone to attend the meeting with you? This is sometimes they are asking, but it doesn't mean that they will cut your mark. But usually they're keeping it in a protocol that do you want anyone to meet? So that one, but they cannot cut your mark because of this just inviting the attendant. They cannot cut usually. Okay? And you asked me the expectation, so I told you. You told me about everything that what I'm having in a very good way, as I told you that in a very a good way with picture you tried to explain to me, and that was very good. But a golden pause, even if with minimal thing, but the patient was worried, right? So they are expecting a small, even a smallest golden pause. So just to that we have something concerning news about the result, because I'm expecting. So that golden pause was, I think, a little bit missing. Other than that, then you told about the decision of statin, and better to follow the scenario, actually. Here, if you look at the scenario, I have mentioned the consultant has decided. So here you have mentioned we have decided. Better to tell whatever written exactly. They are asking that, they are expecting that actually this who has decided, or if it is written the team has decided, it is okay, we have decided. But if it is written the consultant, you need to put effort on that one, because so that the patient can be a little bit more confident that yes, the consultant has decided, and you are just telling him the information that yes, you need to start that one. So better to exactly mention him if it is already written that yes, the consultant has decided. Okay, so this one, yeah, one jargon I think in between you told arteries. Don't mention arteries, rather blood channels. In the next after one line you have told blood channels, but arteries, veins, please better not to mention. Okay, better even if you want to mention, you need to explain to them that yes, this one is the, I mean, blood channels. Okay, so they're taking it as jargon. Okay, so this is the small thing. Anything else? Okay, and do you think if I'm giving you another 2 minutes, do you want to add anything else at the end of the meeting?
Though I will further ask that do you have any other compulsions that's stopping you from taking medications?
Okay,
Then
you have already asked me twice, right? Once I told you,
yes.
you have asked me twice. I think you were thinking about me, and this the same what you were expecting. The next communication is about that one. So there is a recent communication. I could understand what you were expecting. So this actually this one came in this way. So whatever the patient is telling you, trust it. If they're telling no, I have no other issue, the multi drug, but you have asked me twice, that is good, very good. Why? Whenever somebody is refusing, I don't want to take, you need to ask why. Why? Is there any problem? But to why means they have answered the same answer, then it is okay. You don't need to ask them thrice. Okay, so it is okay. Anything else? Like social questions, right? That if it
Yes,
is
exactly. I will try to ask about the job.
smoking,
And
alcohol.
yeah, I will talk about the job and smoking, alcohol, and whether or not she's supported by someone
Yes,
at home.
yes.
That's important because he is supported by someone.
Yeah, so that was missing a little bit. That one
Yes.
actually you could tell. So I think you explained about the mechanism more. That's why you didn't get that time to explain. I mean, to ask about the social question. So once you already explained to her that yes, because whenever drug actually, they are specifically saying that specific point if you are touching it or not, like 2 or 3 small thing you need to tell also, like statin, how she told you this is new drug, he doesn't even know that if he should take it in a injectable form or oral form. So you need to take it's a tablet, you need to inform him it's a tablet, you need to take it every day, like the doses, if you know already the doses, and that one also important to mention. Then mechanism of action, already you told that yes, the mechanism of action, it is how it will help you, how it will just lower down the cholesterol. So these 3 things, that how it should be taken, the doses, orally or the route of administration, okay? Orally or subcutaneous, it is a must actually. Any drug, how they are taking, it is orally, subcutaneously, injectable form, this one is the one. Then the dose, it is the, if 1 dose, 2 dose, if you know. If you don't know, omit it, no problem. But if you know, then please better mention. Mechanism of action, you very much I mean, you nicely explained the advantage, you nicely explained, mashallah. You cannot see my screen, I don't know.
Right now I can't see, ma'am. I can only see the your logo. Right.
Okay, just
Yes, now I can see the screen.
okay.
Yes.
Okay, so this one advantage you told me very nicely. You drew the arteries and everything. And if I'm not taking, what could be the consequences? This one also very much important, the risk factor. This one also you mentioned. Disadvantage, even if I'm not asking you, you should tell that there could be, because any medication, when we are prescribing, this is our first duty to tell them even the rarest side effect that it can have. Okay, because if you are not telling, maybe next time your next communication will be medical error, that the doctor didn't mention about the muscle pain. why I'm having this muscle pain. Okay, so before expecting that he is going to ask me that question, what is the side effect, you need to mention, even they are not asking, this has marks. Okay, so I asked, you told it's okay, but don't forget, even if it's not asked, you need to answer, tell them, inform them. This is the pathway, I mean, the protocol of a drug introduction. Okay, so nice. Yeah, this is all the things that
Thank you, ma'am.
I think, but you did well. I love your presentation. You were so much confident and fluent, and that is a very much plus point. Thank you so much, Thomas.
Thank you, ma'am. Thank you, ma'am. One more
Yes.
thing.
Yes.
You
Yes.
mentioned that there was some recent case.
Yes. We will do it the next case. Let me discuss with the next, inshallah, Dr.
Sure,
Hiba
ma'am.
will
Sure,
do
please.
that. Dr. Hiba will do that. Okay.
Thank
So
you.
this one also recent case, but not in the first diet. I think last year it came. So it is just introduction of a statin, but this year they have done it with a little bit twisted version. Okay. So just in between, I want to tell in a short, if drugs, then which are the things we should tell. I mean, which are what should be the protocol of if any drug into starting of any drug, if it is there, because some specific rules you need to follow, specific steps. Okay, so first of all, if there is, it's for generalized any drug introduction, okay? So any drug. So it could be, I will tell you some scenario that came in the recent diets later on, but let's just start with the form. There should be a form that how you should start with. So first of all, route of administration, how they're going to take it. If it is oral or subcutaneous or injectable, whatever it is, you need to mention. This is the first thing. Those, if you know, please mention. Like methotrexate, you know that it is weekly we are giving, 1 week. Statin, you know that it should be orally you are taking, you should take tablet by mouth, not orally. Don't use the word oral, better to take by mouth. It is in a tablet form, you have to take it by mouth daily. And better, if you even know that, better to take it in a empty stomach, if like that, or in a specific time. So if these are the things you know, like PPI in empty stomach you have to take. So if you know any plus information, any extra information about the medication, how to take it, please mention. So this is the first thing about the drug. Second, mechanism of action, how it will help you. So just as Dr. Moazan very nicely explained, that it will help to lower down the fat, what it is there. Okay, if the fat is up, that's why we're starting, and they will lower down. There is very much explanation you can do that in the liver, it is production. I would advise better not to go very deep. You don't need to make one patient, make him understand that liver is producing this one, and then this will coming down in this. Some medication also there, it is working in the periphery, some in the production. No, don't go deep down. We are not here to tell the to teach the patient that how the pathway or mechanism of action. Just in 1 or 2 lines, that it will help you, whatever it is there, it will help you to remove that. If there is, or if it is increased fat, it will reduce it. Okay, if the heart rate is high, it will reduce your heart rate, like that. But how it is working on the heart, it is working on the blood channels, it is working. No need to tell about that. Okay, I don't know why my today my screen is going off again and again. Just a minute. I hope nobody's video is there. Is there anybody's video? If somebody's video is there, it's happening like that.
No, ma'am, nobody's video.
Nobody's video. Okay. So these are the 2 things. Number 3, advantage. That the same thing actually in the mechanism of action. This is what will happen, and then that's how it will help you. It will help you to reduce the fat, and like he explained very well, that it will decrease the risk of next heart attack or stroke. It will reduce the fat level inside the blood channels. So advantage. Okay, if you are taking this, the risk is in the lower level. Then disadvantage. This is a must. Disadvantage or side effect, this is a must in a medication. The dose, it is, even if you forget everything, the dose, route of administration and the side effect, this is a must for any new drug introduction. Please don't forget this one. Even mechanism of action, it will come in your mouth anyhow. But the side effect, don't forget, and how the patient is going to take, these are important. So advantage, disadvantage. Last 2 points, if any drug interaction. So maybe you are taking any medication, if you are taking, there has to be any drug interaction. Just you can tell if you are starting any other medication, please discuss with your physician that you are taking this medication. Okay, so that is a plus point. You are informing him, because most of the drug, they can have drug interaction. So this one is just a one line. It will take maybe 2 or 3 seconds for you to just mention about this. And if female, you need to mention about if there is any effect on pregnancy or breastfeeding. Okay, so this one also important. That is, these 6 points are very much important in a drug interaction. Later, 2 other also extra point, actually in the 7 or 8, if you want to put that one, you can put that if any red flags, if you see after using that side effect. And if that, then follow-up also needed. But these 2, actually, I don't want to mention it here. Why? Because these 2 is already under your main protocol. Right? Under our main protocol, what we have done, that yes, last time we have done, I think, that yes, the safety netting and the brochure and leaflets. Like safety netting, this is the red flags. That if you are seeing these problems, please come to us. Okay, this can be the side effects. So if you see like that, please come to us. We will follow you up, and also you will be under follow-up. It's not like that we are starting and we are giving, setting you alone. Okay, so this 6, if you can remember, I think that is enough for drug introduction. Any drug. Okay. So Dr. Tejas is asking, if methotrexate counseling is asked, should we also talk about folic acid even if it is not told in the question? Yes, Dr. Tejas. You can mention about this one. There is no harm. And yeah, I mean, but there is also not added marks, I would say. But yes, this is a good impression. As I told you, that sometimes one answer is enough to impress your examiner, so that the next some 2 or 3 answer, if you did do a little bit wrong, they are just considering it. Okay, so impression is the best thing. So adding the folic acid, yes, you have to tell it, because you know about this one, and this should be done with methotrexate. This is a must. You cannot give any methotrexate without folic acid. So it is a must, and you should mention it. Okay, should be asked patient his or her weight? No, Dr. Shen, you should not take any history, not about the weight, height, everything already they have done. They have done the score. Why they have started this statin? Because they have done the QRSK score, right? There is a QRSK score is there, risk score is there. They have already done that. That why we're doing that, they're calculating this risk factor, that next 10 years there is a chance of heart attack or stroke is there or not. That's why when they're thinking that there is a risk, that time only we are starting statin, right? And they have already done everything. They have done taking the weight, BP, everything. The trials done, the investigation done. He was already seen by the consultant, and the consultant has already decided. So now again you are asking him that if you are obese or not. No. So even if he is not obese, any patient with starting of statin, you should tell about actually diet and exercise better. Okay, and involvement of the dietitian also you could do. This one also you can do. Okay, so if you go even with your drug introduction, even if you follow your this protocol, this is also the same. Just in the breaking bad news portion, in this portion, maybe about the drug related 6 points you can add. Okay, drug related 6 points you can add in the breaking bad news portion. Other things are same. So you should not ask about the weight. Okay, Q-risk, yes. And what if she are denied to take at all? Okay, yes, this one we are coming. The next scenario, almost same scenario with a twisted, and your answer is coming, Dr. Arshan. Any other question right till now? Otherwise, we will go to the second scenario. And okay, one more thing. So regarding the drug interaction, what are the scenario drug introduction? I mean new drug. What are the scenario usually came till now? Till now, actually, they have given that day. We have already told you about the thyrotoxicosis with carbimazole. They mentioned about starting of carbimazole. Okay, there is a scenario like that. Okay, then you will have now. This is a recent scenario in part in diet 1. That is the Guillain-Barré syndrome with IVIG. This one also. Okay, then it's coming with hepatitis B, tenofovir. Why I'm telling this drugs? So that at least 2 side effects, important 2 side effects, at least you should note it down. So, because these scenarios they are actually repeating so many scenarios. So even if one scenario is common for you, you are lucky. And both scenarios is common, you are luckiest, right? So whatever came before, better you should know all of them. At least 2 important side effects, as this is the must to mention to the patient. Okay. I think my
Ma'am, what was the first drug name?
Just first drug I also just a minute. Share carbimazole, thyrotoxicosis, carbimazole. Okay. Then Guillain-Barré syndrome, IVIG. Hepatitis B, tenofovir. These are the scenario, real exam scenario here. Okay, I'm mentioning so that you can. Then also warfarin, very, very common case. But nowadays they are giving apixaban and warfarin both together. They are telling that I mean, in a broad term, they are mentioning about anticoagulation drug. So one scenario came, you need to talk about both. Okay, like that. Okay, so this one maybe with AF or something else, pulmonary embolism, whatever it is there, but it came. Okay, so these are the things, carbimazole, warfarin, IVIG, tenofovir, anything else directly? As far as I remember, right till now, these are the things. If anything I remember in between the sessions, I will tell you. Okay, so these are the scenario that came already. So carbimazole, just in a short 1 or 2 things, I will just tell you that you need to touch. The carbimazole, obviously, the lowering of blood count, they have to tell, and about the rash and the shock. I mean, the anaphylaxis, or I mean, it could be have the rash, especially neutropenia, right? The lowering the blood count. So you can have some kind of maybe soreness in your throat, that is throat infection and other infections. So if you see, so here also the safety netting, if you red flags, if you see if there is any rise of temperature, you are seeing any sweating, rise of temperature, lumps or bumps, that means lymphadenopathy. If it is like that, please follow up or come to us as early as possible. So this is important for carbimazole. Neutropenia, this is the important, and rash. These 2 you need to mention there for carbimazole. Okay, they are looking for it. So specific some points are there. If you miss, they are cutting marks and they're writing in the feedback. Okay. IVIG, how you will, explain good antibody. Good antibody. Okay. So this one also, you have to mention about that also the rash. This one, they can have the shock, the anaphylactic shock, how you can mention that it can lower down the blood pressure like that. Tenofovir. Tenofovir, important things, it can have the loose motion. I mean, GI effect is there. It can have the loose motion, throwing up. Okay. It can even affect the kidney and liver. Even cancer can happen in the long run. Very rarest, but it can happen. It can cause. So kidney affecting with tenofovir. One case it was there with starting of tenofovir. Another case was there that the patient, I think already kidney was affected, and tenofovir, it has to be stopped, something like that. I mean, it is affecting the kidney right now. So they maybe are adjusting the dose or stopping it. So these 2 different scenario came. Okay. Warfarin, before it was coming so many times repeatedly, but recently they are going in between. There, one scenario came directly as starting of apixaban, another scenario anticoagulant. In that time, both of them you need to discuss the advantage and disadvantage both together. Okay, so these are the drug cases recently coming. So now, any question from drug? Any question from drug introduction, communication scenario? Whatever the drug, the same protocol. Go with the same protocol here. Okay, go with the same protocol. The route of administration and the dose, if you know, mechanism of action, how it is helping, advantage, okay, disadvantage or side effect, any drug interaction, if pregnancy or breastfeeding, better to ask. Okay, these 6 you need to, and the most, as I told you, that the specific thing, that how the patient is going to take it, and the specific side effect. Any drug, side effect must. Side effect or disadvantage must. Okay. And one extra question after you are telling the side effect, they are usually asking that, no, doctor, then why you are giving me? Is there anything else? Is there any other option? Then you have to tell, like in this case, if the same patient that we just have done, if he was asking that if there are any other options in any other medication you are giving me, because you are telling me that it will affect my muscle and liver, muscle pain will be there. So doctor, please give me some another good medication. So in that case, how you should answer? You should answer that any drug has side effect parallelly of having the advantage. It has some disadvantage, every medication. But in your case, our consultant has already done we have compared that in comparison with the benefit, with the risk ratio, risk-benefit ratio, the benefit is way more high than the risk. This is a very important line. This is also your muscle memory line. This is your muscle memory line, please. The benefit and risk ratio, whenever the patient is telling, I'm not taking it, okay, I don't want to take, why only this treatment for me? You cannot take, no, okay, this side effect is there, okay, I will give you fibrate. No, the consultant has already decided this patient has to be on a statin. So you need to just follow it blindly. You need to follow the consultant blindly, because the benefit, and in comparison with the benefit and risk ratio, the benefit of this medication is way more high, and it has been prescribed in the best interest of your condition. Another keyword of your communication, in the best interest of your condition or patient's condition. Maybe the attendance you are telling. These some lines are there, it has to be in your muscle memory there. So in the best interest of the patient's condition, in the comparison of benefit and risk ratio, these 2 lines are very important whenever they are asking. Okay, that already I answered this one. Dr. Shen, you were asking that if the patient is not, if he's telling, no, I don't want to take it, why you are giving this? This should be your first line to tell that it has been given to you in the best interest of your condition. And if you are comparing the benefits with the risk, the benefits are way more high. Okay, so this is the thing. Okay, so let's go to our next session. Any question I will answer, and then I will go. Any question here?
I have a question, ma'am.
Yes, please.
Ma'am, let's say we know about the interaction of those clarithromycin with the statins, you know.
Yes,
they have got a very bad interaction. Similarly with ketoconazoles. Let's say this Mr. I'm forgetting his name. Let's say
Mr.
this
Sharon.
45-year-old Mr. Sharon. Let's say he was using some clarithromycin. In that case, would we be starting him straight away on statin, or we would be saying that let's pause for the end of your clarithromycin, or when it's finished or dose is finished? Or
yes, when the dose is finished, and the consultant has already evaluated him. He is not on erythromycin or clarithromycin. If he is on, if he is already in your scenario changed, it is an error.
Okay.
Then your scenario changed here. The patient is on clarithromycin, the doctor has prescribed statin, this is error. Then your scenario totally changed. This is not your drug introduction that time. Okay, then you have to tell, sorry, we have started it, it should not be, that's why you are having muscle pain. So this is an error. Whatever drug
Oh, sure. Ma'am, we can't hear you. I think ma'am got disconnected. She will reconnect again, I guess. Ma'am is coming back in 2 minutes. You said in